Pharmacist Ben.
Hey, what's up, Mr. AJ?
How's it going?
Sportis.
You know, Pharmacist Ben.
Yeah.
You get my black T-shirt outfit because I wore my nice shirt yesterday.
Okay.
In anticipation that I'd see you then.
All right. What do you think? I'm a little casual today.
Is that casual for you?
Yeah, I got to loosen my tie up a little bit.
Yeah, there you go. There you go. Well, you know, we have a number of questions here, and thanks everyone for tuning in. This is a lot of them have to do apparently with, I guess you might call this the adrenal complex. I'm not entirely sure.
Third point on the triangle of disease, the adrenal thyroid axis. The adrenal glands, this is kind of simplistic, so if you're a biochemist, you might kind of rip it a little bit, but generally speaking, the adrenal glands produce cortisol, which gives you emergency energy. The adrenal glands also produce reproductive hormones. They also produce adrenaline. Adrenaline and cortisol give you emergency energy. Your reproductive hormones give you energy for growth and for reproduction and for building things. And then the thyroid gives you regular energy. Again, this is somewhat simplistic, but generally speaking, it's accurate. So when the adrenal glands are pumping out cortisol, stress hormone, adrenaline, a couple things happen. For one thing, the adrenal glands are not going to be as efficient at making testosterone and estrogen and your reproductive hormones, DHEA, etc. Progesterone. Number two, when you're secreting lots of emergency hormones, stress hormones, your thyroid will eventually start to slow down to compensate. So hyperadrenalism, or excessive secretion of cortisol, hyper means excessive, hypercortisolemia, we'll call it. Cortisol means cortisol, emia is in the blood. Hypercortisolemia, too much cortisol in the blood, will eventually slow down the thyroid. Once the thyroid slows down, everything slows down because the thyroid controls all the cells, and all the cells of the body do what they do as a response to thyroid hormone, which functions like a foot on a gas pedal, right? Thyroid hormone is the foot on the gas pedal of a cell. So when thyroid hormone is secreted, skin cells do skin things, and bone cells do bone things, and kidney cells do kidney things, and heart cells and muscle cells and brain cells and all the other cells of your body do what they do in response to thyroid hormone putting its foot on the gas of cellular metabolism and cellular behavior. So when the thyroid is not producing thyroid hormone, there's no foot on the gas. All the cells become less functional. Once all the cells become less functional, eventually organs start to become less functional because an organ is only going to be as functional, and that's where you run into health challenges. That's why I call the thyroid, the adrenal thyroid axis, the jumping off point to all chronic degenerative disease. But it's worse than that. You see, the thyroid regulates the digestive system, which is the first point on the triangle of disease. And so you get this vicious downward spiral. As you get more hypothyroidism, you get more digestive dysfunction, more metabolic issues, metabolic syndrome issues, more adrenal thyroid issues, and on this goes. And this is where most of us are existing when we're dealing with a chronic degenerative disease. At the circular, I call it a triangle, but it kind of spins around. So two things are true here. Number one, you cannot do anything about heart disease and cancer and osteoporosis and autoimmune disease and movement disorders and Parkinson's and cognitive issues and all the other health challenges that are secondary to the triangle without working on the triangle. If you go to the doctor with heart disease or hypertension or Parkinson's or whatever, you're going to get treated at that level when the triangle will be ignored. On the other hand, if you address the triangle, everything falls into place. So the triangle is primal. It's the first point. Now, you're going to ask me today questions about all kinds of stuff, and I'm going to repeat this. I'm going to say the same thing I say all the time. And it's important to repeat it. Repetition is reinforcement. I get that. And eventually, it's just going to click and say, hey, wait a minute. Ben says the same thing. And I'm going to tell you, I'm going to say this as simply as I can right now. There is no such thing as a chronic degenerative disease. Let me digress real quick. Chronic means that it's chronic. It happens all the time. It doesn't go away. Degenerative means it gets worse. So chronic degenerative disease, which accounts for 80 plus, almost 90% of our healthcare costs, depending on who you ask. It's the vast majority of our health misery is based on conditions that are chronic. They just keep going. They never end. and degenerative, they get worse over time. This is in contradistinction to how the body operates. The body recovers. You cut yourself, it heals, right? You get a hit, knock on the head or a black eye, it heals. The body regenerates. So chronic degenerative disease represents a major aberration of how the body is supposed to operate. Something's wrong when you have a chronic degenerative disease because the body is built to regenerate. It's built to end illness. And this does happen when you're young. You have an infection, it goes away. You get a trauma, it heals. But most of our health challenges are diabetes and cancer and autoimmune issues and cognitive disorders and movement disorders and Parkinson's disease, blah, 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 on and on and on. All of these represent something as disturbing, a disturbance in the body's normal functioning, chronic degenerative disease. And I'm going to tell you something as clearly as I can state this. There is no such thing as a chronic degenerative disease that does not involve the digestive system and the blood sugar system. And this is not me just making assertions and being some kind of hippy-dippy Mr. Organic guy. That's not what this is about. You see, the body's main job, this is its main job, is to take food and turn it into us. And we take this for granted. Think about it. AJ, a handsome, beautiful face of yours. That is the end result of yesterday's lunch. That hamburger you ate becomes you.
How'd you know I had a hamburger?
All right.
Yes. Do I look like a hamburger?
Look like a hamburger.
Great.
A tuna fish sandwich, a piece of broccoli, whatever it is, it gets converted into us. Think about it for a second. Come on. How does that even happen? How does that happen? And what's even more dramatic, that's pretty dramatic, right? You eat lunch and it becomes your arm. Come on. That's a miracle. It's even to be even more dramatic. Everything we eat goes in one of two directions. It either gets eliminated or it becomes the blood. Did you hear what I said? Our food becomes the blood. What you eat becomes the blood, and then it becomes your arm or your leg or your eyes or your kidney or your heart. It goes from your mouth to your digestive system to your blood. It becomes your blood. Your food becomes your blood. It's about 1% or even less. 99% of the food or more gets eliminated. But 1% of that food goes into the blood, and then the body works its magic. And people, AJ, everybody listening, this is the most amazing miracle that occurs every time we eat. And so when I talk about the first 2 points of the triangle disease, what do they have in common? Digestive system and the blood sugar system. They're food related. And so the body is a closed system, meaning it's a circle with boundaries and it's separated from the outside. When we say the body, we really mean the blood. It's separated. And in physics, we have the law of conservation of momentum within a closed system. A law is something that happens all the time, like the law of gravity. The law of conservation of momentum within a closed system says when you have a circle that's closed, everything stays the same. And so under those circumstances, the body will be perfect. Nothing will happen. But the body has to have two openings. It's not a closed system. It's a closed system except for food and injections. Now, we're going to leave aside injections, but just understand that if you inject something into your bloodstream, you can run into the same problems that people have when they have digestive issues, autoimmune problems, skin problems, heart issues. We all know about the incidences of heart disease and heart attacks and myocardial infarctions and blood clots because people are injecting things. So when you inject things, you can run into the same issues that people have when they have problems with leaky gut, with the digestive system. When I talk about digestive issues, I'm talking about leaky gut because that's how things get into the blood. But we're going to leave that aside for now. From the vast majority of us, this closed system violated or opened through food. And this is why food is so important. But it's a little bit of a problem because you see, with food, you run into psychological issues. Because we don't eat just to eat. We don't eat like lions and tigers and bears. We eat when we're depressed. We eat when we're bored. We eat when we're happy. We eat when we're on a date. We eat when we're at a party. We eat when we're in meetings. We eat for other reasons other than we're hungry. And we overeat past the point where we're satisfied. And our food supply has been completely turned upside down, completely corrupted. The food today didn't exist 100 years ago, and we have a body that's hundreds of thousands, if not millions of years old. So in the last 100 years, which, you know, if the 2 million year old lifespan of the body going back to Homo habilis, you know, our evolutionary ancestors, or Australopithecus, or whatever it is, 2 million years, 100 years represents, if it was a clock, 100 years represents 1 minute to 12. So for most of the day, for every minute of the day, we were eating normal food that we evolved to eat. And then 1 minute to 12, our complete food supply changed. And so all of us are subsisting on foods that didn't exist from an evolutionary perspective as our ancestors were evolving, were growing. So between that and the fact that we overeat, between the completely disrupted food supply, between the toxic chemicals in the food, between the fact that we overeat and we eat for reasons other than we're hungry, of course we're going to have problems. But you can't really say that to somebody unless they're really motivated to make a change. Because when people hear about food, they tune out. And I've noticed this. People don't want to hear about food. Try next time your buddy's eating some French fries or McDonald's hamburger, try telling him how lousy those French fries are for him. See how well that goes over.
I've been down that road.
It doesn't go over very well. People don't want to hear it. And I'm in the position of having to correct people's, and you as well, and obviously longevity. We're in the position of trying to help people with their health, and we have to go there. And so I do go there, but I recognize that it's a tough road to hoe. And only people who are very motivated will participate in that way. However, if they do participate, they can make dramatic changes between dietary modification, eating less food, and nutritional supplementation. You can do dramatic things for every single health challenge. But if you go to the medical model, and God love the medical model, I'm not ripping on doctors, but if you go to the doctor when you have Parkinson's, you go to the doctor when you have eczema, you go to the doctor when you have a female health issue, you go to the doctor when you have Parkinson's or a movement disorder or autoimmune disease or any of the other 10,000 diagnoses, you're going to get doctored. You're not going to get your health corrected. That's not their job. And if you expect them to correct your Parkinson's, you drank the Kool-Aid. You've been infected by the virus because they can't do it. And that's why they say you're going to be on this high blood pressure medicine the rest of your life. You're going to be on this Parkinson's medicine the rest of your life. You're going to be on thyroid medication the rest of your life. We got to take out your gallbladder. We got to take out your female organs. We got to take off your breast. This is what they do. They doctor you. You're going to get doctored. AJ, if you go to court and you say to the judge, "Hi, judge, here's the evidence. It's doctored." What's it gonna? Is that a good thing?
No, it means that you altered it.
You committed a fraud. To doctor a document is to commit a fraud. If you say to the government, here's my tax forms, they're doctored. Oh yeah, really? Is that a good thing? Of course not, because to doctor is to commit a fraud. What does that really mean? It means that they're pretending you're healthy. Oh, we'll give you this beta blocker to drop your blood pressure. So we're pretending you're healthy. We're doctoring your symptoms. But they're not doing anything about the cortisol or the adrenaline or the insulin or the blood sugar or the histamine or all the causes of the hypertension. They're doctoring you. They're committing a fraud. They're making it look like you're healthy by dropping your blood pressure. And again, this is not a knock on doctors. I have so many friends who are doctors, and they're beautiful people. They got into the business to help. It's the paradigm, the pharmaco-medical paradigm, that is anti-humanity, that is misanthropic. It's not the individuals. The individuals are beautiful people, and I know them. I know a lot of them. I mean, I don't know all of them, but I know many, many physicians and healthcare professionals who got into the business, and they're great people. But if we go to a medical professional to deal with a chronic degenerative disease that's lifestyle-based, not only are they not going to help us, but more often than not, the situation is going to get worse, and it represents an abdication of our personal responsibility and the manifestation of an infection by a parasitic mind virus that could care less about you and only wants to spread its seed, in this case, informational seed. And that's why we see these commercials. I mean, you watch TV, we're gonna watch the football game today. You're gonna see commercial after commercial after commercial for Dupixent and for Jardiance and for Plavix and for this drug and that drug. And by the way, most of the drugs that you see advertised are biologics. These biologics, the reason you see them advertised is because they're ungodly expensive. They'll cost you $10,000, $20,000 a month sometimes. A month. Not you, but your insurance company. But of course, that's all of us. And these are drugs that shoot down inflammation because, as we said earlier, all disease involves the blood, involves dirty blood, but really the medium or the vector of the disease is inflammation. And so the latest biologic drugs work in this high-tech way to shoot down, really kind of very fascinating mechanism, to shoot down inflammation molecules, cytokines they call them, to shoot them down. And they're extremely expensive, and they do quiet inflammation, but they don't quiet the cause of the inflammation. And as long as you have the cause of the inflammation, you're going to have a shortened, if you haven't corrected the cause of the inflammation, you're going to have a shortened lifespan. And you're going to run the risk of other health challenges.
And be dependent on that drug.
If they even work. Yes, and be dependent on the drug, if they even work. But, what is inflammation? Inflammation is a protective response. We talked about this yesterday, right? Inflammation is a defensive response. If you have a defensive response and you want to end that defensive response, you got to figure out what the offending agent is. And then you remove the offending agent. The offending agent is something that's gotten into the blood. And once again, we get back to the blood. How do things get into the blood? Injection or food? So when I talk about food and talk about the digestive system as the first point in the triangle of disease, and we talk about blood sugar system, which also involves food, as the second point in the triangle of disease, it's because these two primal points, the base of the triangle, represent the disturbances. These are where the disturbances come in from the closed system. You follow what I'm saying?
Yes,
and
sir.
I'm not saying that because I'm Mr. Organic Guy. I'm saying it because this is power. This is our point of power. If you've ever gone to the medical model and tried to get your autoimmune disease taken care of, your psoriasis or your heart disease, whatever it is, and you're frustrated because now you're on a beta blocker and you can't get your butt out of bed, you can't function, and nobody's helping you with your psoriatic plaques or your whatever it is, your cancer, your autoimmune disease or whatever, it's because you've abdicated responsibility for your health challenge and you're not doing what you need to do to address the attack, because that's basically what's happening. And you're saying to the doctor, you fix me. And there's a price to be paid. And that price to be paid is represented by the fact that we have more doctors per capita than any other culture in the history of mankind, more drugs, more devices, more hospitals, more insurance programs, more protocols, more know-how. And we're the sickest and the fattest. And our lifespan drops every year, pretty much, in the last few years anyway. And it's impossible to find 3 people without 1 or 2 of them having some kind of chronic degenerative disease, adults, that is. And that's because we abdicated responsibility. So let's answer the questions I'm going to show you. You're going to get bored. You're going to roll your eyes.
Never get bored. I may roll my eyes just for fun.
I'm going to do the same thing. I'm going to say the same thing I was saying. Let's let her rip.
Okay, so let's first talk about or answer a question regarding the beta cells in the pancreas. If the doctor says this person doesn't have beta cells, this is why they have diabetes, can we find a way for this person to grow beta cells?
Well, you're not going to grow beta cells, but the reason why beta cells become dysfunctional is the reason why all cells become dysfunctional. Remember, all disease is cell disease, but all cell disease is preceded by dirty blood. Same thing. So beta cell dysfunction follows inflammation at the level of the pancreas. Anytime an organ is really working hard, it's going to be susceptible or predisposed to inflammation because when it's working hard, it's using up nutrients and it's producing waste. So if you're not really taking care of yourself and you have an organ that's really, really working hard, that's an organ that's going to be predisposed to having problems. The pancreas works very hard because the pancreas is responsible for producing chemicals that process our calories. Pancreas makes insulin, everybody knows, and the beta cells make insulin, but the pancreas also makes enzymes. It also makes sodium bicarbonate, it makes digestive juices. So the more you're eating, the more your pancreas is working. The more you're eating sugar and carbohydrates, the more your pancreas is working. The more you're eating fast-burning carbohydrates, things that really spike the blood sugar, the more your pancreas is working. So when you have a beta cell issue, you can have that beta cell issue either following overwork, and that is from eating too much. So what you want to do in that case is eat less food and use digestive support strategies, and especially restrict your intake of fast-burning carbohydrates. And in terms of digestive support strategies, use enzymes, and especially pancreatic enzymes. These will all support the pancreas. But there's another way that beta cells become dysfunctional, and that's because of attack, immune attack. That's called type 1 diabetes. That's called autoimmune diabetes. And that's when the beta cells just die. Now, immunity is related to the digestive system. So, and type 2 diabetes is also related to the digestive system. So in a way, type 1, type 2 diabetes it's kind of a false distinction, because they're both related to blood toxicity and overwork of the pancreas. So there's a superficial distinction between type 1 and type 2 diabetes. Type 1 diabetes is when the mechanism involves an attack of an immune attack of the beta cells. Type 2 diabetes represents overwork of the beta cells, but they're very similar. So for both kinds of diabetes, you focus on the first point of the triangle disease, restrict your intake of fast-burning carbohydrates. By the way, both forms of diabetes are reversible. They'll tell you type 1 is not reversible. It is reversible if you correct the causes of the inflammation and the activated immune system. This is not what the medical people will tell you. The medical people will tell you there's no cure for autoimmune diseases. There's no cause. They don't even know the cause of autoimmune disease. I'm telling you the cause is dirty blood. It's toxicity in the blood. And I'm not telling you just as an assertion. Get online and look up histamine and autoimmunity. Look up leaky gut and autoimmunity. Look up molecular mimicry and autoimmunity. Molecular mimicry is when the food particles look like your thyroid or look like your pancreas. Just go online and look at it. I'm not telling you anything that's not in the literature. I'm not making stuff up here. Your doctor doesn't read. I don't mean that. Your doctor is not a researcher. He's a clinician. Now, there are doctors who are researchers, and they understand what I'm saying. But the clinicians are working clinically. So anyway, for the beta cell guy who you're talking about, ketogenic diet. Restrict the calories. The key to the ketogenic diet, which people miss, is it's a low-calorie diet. The ketogenic diet is not just, everybody knows about a high fat, because everybody loves fat, and that's great. But it's not just high fat. It's a high percentage of your calories coming from fat. It's not a whole bunch of fat. You know, people hear ketogenic diet, and they're like, oh, yeah, bacon and French fries and hamburgers, you know, all the fatty foods. I could do that all day, right? That's not the ketogenic diet. The ketogenic diet is a 1,200 calorie a day diet where 80 to 90% of your calories come from fats, good fats. So if you say 90% of your calories or 80% of your calories are out of a 1,200 calorie a day diet, that's 960 calories coming from fat, something along those lines. Okay, so that's a good amount of fat, but it has to be quality fat. And you want to make sure your body's not working hard, and that's why your calories are low. So first of all, ketogenic diet. Especially low carbs, 10% or so carbs. And the carbs you want are fibery carbs and not sugar, not sucrose or fructose for that matter.
Example of a fibery carb, vegetable?
Yeah, vegetables, exactly. Okra, squash, zucchini, vegetables. Vegetables are your best friend. Now, vegetables are not totally benign either. Some people react to them. But find ones that you don't react to. And most of your calories should come from vegetables as long as you're not reacting. And grains and flours and cereals and pasta and rice and potatoes, keep those down. Then secondly, use digestive support nutrition. I-26, I absolutely love the I-26. The I-26 is specifically designed to kill bacteria that proliferate in the small intestines, a condition called SIBO. The ultimate enzymes, the daily digest, all of these, the ultimate microbiome, we got great digestive support products. And I have to say, hats off to the Wallachs, Dr. Wallach and Steve and Richard Rent and all the guys who formulate the longevity products over the last couple of years. They've really understood how important digestion is. And there's a lot of wonderful new products that are focused on digestive health. Then you go to the triangle, then the second point in the triangle, that's blood sugar and insulin. Obviously, you're going to restrict your intake of fast-burning carbohydrates, so that's going to help. But also, longevity has great supplements for helping your body process sugar. Some of those supplements include the Sweeties, which everybody knows about, the healthy blood sugar pack. There you go, the healthy blood sugar pack. The Fucoid Z. Fucoid Z not only will help you with your blood sugar, but Fucoid Z is also a blood purifier. My buddy Stan at Stay Natural, brilliant guy, and his wife, Dr. Laura Dennison, brilliant healthcare professional. They got a blood cleansing product, and it's called Hope. Right? There you go. All right. And hats off to Stan for formulating the TMR shake. Love the TMR shake. I use it every day. Okay. And that's a great way to fill up. The TMR shake is a great way to fill up without having to take in a lot of sugar. Fiber is very helpful for lowering your blood sugar, especially with your meals. Water, just plain old water will lower your blood sugar. Just plain old water will dilute your blood so your blood sugar concentration drops, especially first thing in the morning. Walking, exercising, shunts sugar from the blood into the muscle. These are all great strategies for helping control elevated blood sugar.
Ultimate niacin?
Stabilizing insulin. Yeah, let me go to some supplements specifically. Ultimate niacin. Absolutely. Niacin is part of the glucose tolerance factor, which is a complex of molecules that helps the body process sugar, helps support insulin. Alpha lipoic acid, thiamine, vitamin B1, which you'll find in the Beyond Tangy Tangerine. Thiamine is a must-have for diabetics. In fact, thiamine deficiency will cause many of the health issues that are associated with diabetes. For example, peripheral neuropathy. In fact, thiamine, which is B1, vitamin B1, was the first vitamin to be discovered back in the 1880s and 1890s. 1890s, I think it was. And you know how they discovered it? They noticed that people who were thiamine deficient had peripheral neuropathy. Thiamine is important for blood sugar processing. So the more sugar you eat, the more thiamine deficient you're going to be. The more sugar you eat, the more thiamine you need. Thiamine deficiency will cause mental health problems, depression, anxiety, aggressive behavior. You got to wonder how many of the kids who are shooting up the schools and wreaking havoc in the schools and in our cities and our families are suffering from thiamine deficiency following Pop-Tarts and Captain Crunch and orange juice and Danishes and all the things we eat for breakfast. So the more sugar you eat, the more thiamine you need, more niacin you need. Omega-3 fats, magnesium, zinc. These are all wonderful nutrients for helping the body process sugar. So for your friend with the beta cells, first 2 points on the triangle of disease. Now, if you want to go all out, relax. This is where the third point in the triangle of disease comes from. Now, there's this whole element of mind-body. We don't talk about that enough, but it's very, very important not to underestimate the power of the mind. And I don't want to ever be that kind of nutritionist that says, oh, just take this vitamin or this supplement or this formula. You got to understand this between the ears. You know, when they test drugs, and when drug companies test drugs, they have to filter out something that completely throws off the results of the tests. You know, when they do drug tests, they give you a drug and they see how you do. And they compare it to somebody who got a fake drug. They call it a placebo, right? So if me and you are in the laboratory and they're testing a new drug, they'll give you a drug and they'll give me a drug that looks, or a pill that looks like a drug, but it's just sugar. It's a sugar pill. And they'll compare and they'll say, well, what happened here? Did AJ, his blood pressure drop more than Ben's blood pressure? And then they'll say, okay, that's a good drug. However, this is so cool, right? If the administrator of the drug, the guy who gives you the drug or you the pill and me the pill, if he knows that you have the pill, the medicine in your pill, and I have the sugar in my pill, it will somehow get transmitted through his mind and it will throw off the results. And you'll get better results. You'll get better results than me. And they have to filter that out. They have to do what's called a double-blind study. Have you heard that term? Double-blind. Double-blind means you don't know and the administrator doesn't know and you don't know. Because if the administrator knows, it's going to throw off the results. How does that even work? Because if I believe something, it might work. That's called the placebo effect. And they have to eliminate the placebo effect to make sure the drug really works. What does that tell you? That tells you a placebo can work just as good as a drug. Well, what does that tell you? That tells you that your mind is making the drug work or not work. There's something called a nocebo effect. The nocebo effect is when you don't believe something's going to work and it doesn't work. The placebo effect is when you believe something's going to work and it does work. It's the mind. Do not let them marginalize your brain. They want you to think it's just your body. They don't want you to know you have power. Your mind has power. Your mind creates. Your mind makes your life. Yes, the body is important, obviously. But the mind can control the body. So by calming down, by meditating, by plugging into God or spirituality, or even if you just want to breathe, practice slow, deep breathing, all of these will slow down the adrenals, calm the body down, activate the vagus nerve. And the vagus nerve represents the parasympathetic nervous system, which is responsible for resting, digesting, creativity, immunity, skin health, cosmetic health, growth, repair, and healing. So if you want to go all out, work on digestive health, work on the blood sugar system, and relax. There's also great nutrients you can take for the adrenal glands. And what you do for the first 2 points will help the adrenal glands, but you can use our de-stress. Vitamin B5, by the way, which is in the de-stress, is a remarkable, very underappreciated nutrient for energy, especially quick energy, emergency energy for supporting the adrenal glands. And by the way, last thing I'll say here, as important as the thyroid is, as the jumping off point to all health challenges, and as important as hypothyroidism as cause of illnesses, Dr. Broda Barnes wrote a book called Hypothyroidism, the Unsuspected Illness. And he said everything is hypothyroidism, and he was right. There's nothing you can do for the thyroid. Nothing. Nada. Zero. Except take thyroid hormone, which doesn't even really work very well. However, by working on the adrenal glands and the blood sugar system and the digestive system, the thyroid will take care of itself.
Okay, so is that what this second person who is on the levothyroxine,
levothyroxine,
levothyroxine, and also is losing her hair at 81? Is that you just kind of explain what she needs?
Absolutely, I explained her, and probably the next person too. I probably explain. Now, at 81, it's very the body naturally starts to slow down, starts to break down. That doesn't have to. It's not inevitable. There are people who are in their hundreds, 110, 120, historically anyway. I don't know about recently. They live in these places called blue zones. There used to be a commercial where they were hauling logs up a mountain. You ever see a yogurt commercial it came out in the 70s or the 80s? I don't remember what it was. Wow. And they show these people who lived in Azerbaijan and in Central Asia in the mountains, and they were eating fermented food. And as Dr. Wallach has pointed out, they were drinking, he calls them glacial milk. They were drinking mountain water, which has lots of minerals dissolved in it. And so these people were in their hundreds, and they had kids who were in their 70s and 80s, and they were living full lives. So the body is capable of a lot of things. But in our culture, 81, you're going to start to feel things. Things are going to break down. Hair is a classic sign of hair loss, is a classic sign of hypothyroidism, as well as estrogen issues. And you got to recognize that the hair, while we love our hair, everybody loves hair, right? Nobody wants to be bald. The body doesn't care about the hair. The body cares about the heart. And it's going, under conditions of nutritional deficiency, it's going to reroute nutrients to the core, the viscera, the heart, the kidneys, the spleen, the lungs, away from the skin and away from the hair. And this is why the skin and the hair start to suffer faster, and nails, by the way, start to suffer faster than other parts of the body. They're the canary in the coal mine. I'm in estheticians. The first thing you want to look at your clients is their nails, because the nails will demonstrate nutritional deficiencies faster than any part of the body. Plus, they're on the outside, and so you can obviously see them. So for this gal, digestive issues, and you want to hear something interesting. I talked to this gal. I'm pretty sure this is the gal I talked to yesterday. Long-standing digestive issues, long-standing leaky gut, long-standing issues with histamine. And I believe it's the same lady. She had a hysterectomy following problems with her gut. Nobody told her. And coming out there, if you're dealing with if you're dealing with female health issues and they want to take out your organs, don't let them. Look to the gut, because one of the major amplifiers of estrogen and toxic estrogen, which is a whole other story, is leaky gut and histamine. So for this gal, digestive, blood sugar, all the things we just talked about, and then she probably wants to do some adrenal things. Fats are very important. Essential fatty acids, your ultimate EFAs and ultimate EFA Plus, are very important for all female health issues, because they get converted into inflammatory and anti-inflammatory hormones, and they also support the production of the steroid hormones.
Okay, well, since you mentioned female issues,
yes,
we have about a 25-year-old superb athlete who is having trouble with her menstrual cycle.
Well, how old is she? Did you say 23?
25.
25. A lot of times female athletes will be out of balance with estrogen and testosterone. They will be producing lots of testosterone, and testosterone is important for muscle building, athletic performance. And so it's not unusual for female athletes who are hardcore athletes to stop menstruating. And that has to do with the female hormone system. So what she wants to start doing is using the ultimate EFAs and supplements that help support the production of estrogen, and anything that interrupts or interferes with the production of estrogen has to be eliminated. So assuming if she's a high-powered athlete, I'm going to assume there's no inflammatory issues, although there might be, but we're just going to assume there aren't. If there were inflammatory issues, she'd have to control those, because those can interfere with the production of estrogen, ovarian estrogen, or adrenal estrogen for that matter. And then also metabolic syndrome. And this doesn't sound, I don't imagine it's this athlete, but for everybody who's interested in hormone health, you should know not only is leaky gut going to interfere or cause problems with the female hormone system and the male hormone system, but so will metabolic syndrome, which is blood sugar issues. So metabolic syndrome is one of the hidden causes of low T, or of low estrogen, or poor estrogen clearance. So you got to work on metabolic syndrome, obviously the second point in the triangle of disease. And then supplements that help her build estrogen. Magnesium is very important. Vitamin C is very important. The B complex, particularly vitamin B6, is very important. And then the ultimate EFA, she can also use the XeraTest. That might help her. I'm sorry, XeraFem, not XeraTest, but XeraFem. That will also help her. And then I would ask her about any other health issues that she might have so we can correct those. Problems with the female reproductive system need to be backtracked to other causes. And this is one of the major rules of naturopathy, of healing naturally. Naturopathy meaning the healing without drugs or without surgical interventions. One of the major principles of naturopathy is where you see the disease is not where the disease starts. And so you want to backtrack. In engineering, they call that troubleshooting. If there's something wrong with your computer, they work backwards to see where the problem is. It's called troubleshooting, and that's how you do naturopathy, and that's how you heal the body. You work backwards. Unless it's a digestive issue or a blood sugar issue, your health challenges are usually going to be backtracked to those 3 points in the triangle of disease.
Okay. A number of other questions, Ben. We'll try and go kind of quick
on these. More so we don't have too long, but we'll do another one soon. I'm going to be on Daily with Doc tomorrow.
A little on alkaline water and supplementation from
Don't fall for alkaline water. Don't fall for it. It's a scam. It's rude. It makes me angry.
What do you do about hemochromatosis?
Well, let me talk about alkaline water real quick. The way your body alkalinizes is through oxygen and by staying healthy, because when cells die, they release acid, or when cells are overworked, they produce acid. Acid's a waste product. When the blood becomes acidic, we don't feel good. The blood has to be slightly alkaline. So alkaline water is going to help, because when you drink water, it goes into your stomach, it becomes acid. The stomach's low pH. Now, there are minerals in alkaline water, and minerals can support buffering, and those are important, but get your minerals from veggies. You don't need to spend money on alkaline water. Reverse osmosis water, and then distilled water. Those are the two best kinds of water. Spring water actually is the best, but you just don't know where the springs are. So if you know where the springs, you're sure the spring is clean, that's the best water. Reverse osmosis and then distill. And then hemochromatosis is a liver issue. The liver controls iron levels. Hemochromatosis is an iron condition. You can't do anything about hemochromatosis. They give you blood transfusion. They give you they remove blood. That's the only thing they can do. It's a liver problem. The liver is a digestive organ. It's the link between the digestive system and the blood. It's one of the links between the digestive system and the blood. It controls the iron. So you want to consider hemochromatosis to be part of involve liver health. Liver health is about the digestive system and the blood sugar system. The health of the liver is dependent on digestion, the foods we're eating, and blood sugar. And metabolic syndrome and liver disease go hand in hand. Fatty liver, that is. And fatty liver is an epidemic. 1 out of 3, or even more at this point, probably, this was a few years ago, 1 out of 3 Americans have fatty liver disease. That's crazy. That's 100 million plus Americans have fatty liver disease.
Would you do something like this?
Metabolic syndrome. Treat it like a diabetic. I can't see what it is. Tell me.
Colin Burst liver formula?
I don't know. I haven't seen that. That's a new one. I haven't seen that.
You had a commercial about it. That's where I got it from. You had a
Colin Burst liver formula?
Yeah.
Pollen burst is a caffeine thing. I didn't know there's a liver formula.
Yeah, they had a liver formula. And then the Daily Digest also has a liver cleanse.
Oh, yeah. Thank you. Dr. Ariaza's liver cleanse.
Yeah.
Do you know Dr. Ariaza? That guy's brilliant. He's not only a brilliant clinician, he's a brilliant network marketer.
He is.
Really, I listen to his talks on Facebook, and they do these lives. That guy's so inspiring.
Yeah.
And I've been doing self-help and personal development pretty much my whole adult life since I was 20 years old. I've been doing self-help and personal development. That guy's a master. And not only that, he's also a formulator and he's a clinician and he understands health and nutrition. And he developed this thing called Dr. Ariaza's liver cleanse. Anybody who has a liver problem or a gallbladder problem, for that matter, should be using Dr. Ariaza's liver cleanse. If you are out there as a distributor and you understand what we're talking about here with the triangle of disease and metabolic syndrome and liver health issues, that could be one of the best pieces of advice you ever give somebody who's dealing with any health challenge is to get on Dr. Ariaza's liver cleanse. It's an amazing, amazing product.
Pharmacist Ben, I'm not going to let you go just yet.
Okay.
If someone has osteoporosis, how long would it take them after being on a longevity program to get better?
Osteoporosis is not a disease. I did a video on this just, I think, a couple days ago, Sunday. You go on my LinkedIn profile. And the headline of the video is osteoporosis is not a disease any more than wrinkles are a disease. Are wrinkles a disease? No. They're a sign of deteriorating tissue. Osteoporosis is wrinkles of the bone. Wrinkles is osteoporosis of the skin. And I can look at somebody and tell you whether they're towards wrinkles or prone towards osteoporosis just by looking at them. There's a certain body type that is prone to both. Osteoporosis is deterioration of the bone. It's a degenerative condition. It follows same things, inflammation. Once there's inflammation at the level of the bone cells, they're called osteoblasts. Osteoblasts make bone. They're cells that make bone. Pretty cool when you think about it. These cells actually will make bone tissue. And bone is connective tissue, like your collagen. And bone are mostly made of collagen. Or a good part of bone is collagen. So the number one reason is degeneration, and the cause is inflammation, blood, dirty blood, at the level of the osteoblast. However, as we talked about just a moment ago, when the blood is acidic from toxicity, or from cell death, or from overworked cells, stressed out cells, the body has a mechanism for raising the pH of the blood, alkalinizing the blood. The blood pH is tightly regulated because all the chemistry, when you think about the blood, it's important to recognize the blood is like this chemical factory. It's seething with chemical activity. When we think about the blood, we don't realize how complex this is. The blood is tissue. It's liquid tissue. It is an organ. It's so complex. And this is why inflammation at the level of the blood is so problematic. The blood pH regulates the chemistry in the blood. So the body takes the pH of the blood very, very, very seriously. And there are mechanisms for alkalinizing the pH of the blood.
Pulling calcium out the bones?
Bingo. That's exactly right. Now, oxygen is the main way. But yes, calcium will leach out of the bones as a mechanism for raising the pH. Calcium's alkaline. So it raises the pH. This is where calcification of tissue becomes a problem. Bone spurs, stenosis, calcification of the brain or the heart or the kidneys. One of the ways we die is we turn to stone. We calcify to death. Our organs become stone-like. And this is from deposition of calcium, which has gone out of the bone into the blood, and it just gets deposited in various tissues as it leaves the blood. So osteoporosis not only follows inflammation, it also follows long-term blood acidity. Bone spurs, the same thing. These are all representative of calcium leaving the bones as to alkalinize the blood. And then the third thing is nutritional deficiency and non-calcium. We get plenty of calcium. I don't say plenty, but it's not a calcium issue for the most part. It's a protein issue. So the bones are made of protein, collagen. So in addition to zinc and strontium and magnesium and calcium for the bones, you gotta make sure you're using your collagen peptides and collagen itself and whey protein, which contains the building blocks for making collagen. And most importantly, and I'm serious, most importantly, vitamin C in your Beyond Tangy Tangerine. Beyond Tangy Tangerine contains the nutrients that turn on the machine for making bone. You can have all the collagen peptides you want, all the collagen you want, magnesium, calcium you want, strontium, zinc, all the nutrients, all the components of bone. But if you don't have your BTT, you're not going to make collagen. And that doesn't just mean you're in your bone. It means in your face too. Anything you can do to strengthen your bone will strengthen your skin, will produce collagen in your skin to keep you from getting wrinkles. And collagen is also forms the foundation of your heart. So arrhythmias and tachycardias and heart disease can be caused by deterioration of the heart's collagen, the heart's connective tissue. So building collagen is not just going to help you with your bones and your skin, it's going to help you with your heart. And it's going to help you with your vascular system, your blood vessels. They're also made of connective tissue largely. And so building your connective tissue is going to help your blood vessels. And all of your organs are wrapped around tightly with fascia. Did you ever, when you were a kid, did you ever rip open a baseball? Or did you ever?
Yes.
Right?
Or a football, yeah, but yeah.
Baseball. Baseball is or a golf ball. If you look at a baseball, and you take off the covering of the baseball. When I was a kid, we didn't have a lot of money, and so we used our baseballs till they became like nothing, and we had a creek in the backyard, and the base of the ball get all soggy and wet, and eventually the cover would come off, and I was always amazed at the inside there was like rubber bands on the inside. Those rubber bands give the ball spring. So when you hit the ball, these rubber bands contract, and that causes the ball to go far. That's how baseball and golf balls, for that matter, too, are constructed. The body is the same way. We get spring power from rubber bands that are wrapped around our muscles and wrapped around our tissues, our organs, and our body. And these rubber bands have a propulsive effect, and they allow us to move. They allow our organs to move. They're not rubber bands, but they function like rubber bands. You know what they're called? They're called fascia. And if you could look at your organs, you would see they're all wrapped around with this spider web-like material, this fine gossamer webbing, which is made of collagen. It's your fascia. And so as we get older, like everything else, our collagen in our face starts to deteriorate, our collagen in our bones starts to deteriorate, our collagen in our heart starts to deteriorate, our collagen in our blood vessels start to deteriorate, and our fascia starts to deteriorate, and that causes a loss of organ function as well as a loss of mobility. I forgot to mention, collagen is also important for the joints. So for being able to move at your joints, your elbows, your wrists, your fingers, your toes, your ankles, your knees, your hips, these are all things that deteriorate as we get older, and they account for not only a tremendous amount of pain, but a tremendous amount of lack of mobility, of sedentariness. My poor mom, she's 90 years old, 91 years old, never took care of herself. Now she's starting to take care of herself. It's a little late. Her connective tissue is completely deteriorated. Every move she makes is painful. She can't even move. So now it's a little bit better. Now I've got her supplementing the last couple of years, so it's a little bit better. But for a long time, she what do you know about anything? You're not a doctor.
You're only my son.
Yeah.
That's right. Finish your thought, please.
What?
Finish your thought.
No, I think I finished.
Okay, I get two more quick ones.
Yes, sir.
Which is really three. But when you start talking about the importance of vitamin C, my question is: there a particular form of vitamin
acid? No, you don't need to do nothing fancy. Topically, you need fat-soluble vitamin C. That's a whole other story. That's a very specialized form of vitamin C, fatty vitamin C. Vitamin C is water-soluble. When you eat it, your body handles it tremendously well. Now, if you have intestinal issues, that's another thing about intestinal issues is not only does toxicity get into the blood, but you also suffer from malabsorption because you got to have a healthy intestinal lining in order to absorb nutrients into the blood. So people who have intestinal problems can be deficient in vitamin C and other nutrients. But assuming, that's not a problem, ascorbic acid is fine.
Okay, but is there something better than ascorbic acid?
No.
Okay.
Not internally. Topically, there is. Not internal.
Okay. So now, what about fighting off potential? The seasons are changing. Potential threat of the COVID
Okay,
virus.
I'll talk about that in a second, and I want to talk about that balance, that seesaw thing that we talked about before. But let me just say one thing: there are some fancy forms of vitamin C, particularly what they call mineral ascorbates, and they're not better forms of vitamin C, but they do give you magnesium and potassium and zinc and other minerals. So you get extra nutritional value, but you don't get a lot of vitamin C in these mineral ascorbates. So for vitamin C power, ascorbic acid's fine. And then let's talk about the balance, the seesaw thing. Remind me for our next talk, we'll talk about that balance, that seesaw thing that you and I talked about. And then what was the last question you asked?
COVID is one.
Oh yeah, COVID's the immune system. It's like cold sores. Cold sores, people get ear infections. Kids who get ear infections, people get constant viral infections, shingles. I don't know if you've seen the shingles, the shingles commercial.
They're going heavy with that one.
They're going heavy with it, right? Shingles
and monkeypox.
And now it's monkeypox, right? Strengthen your immune system. It's too much to talk about in just 2 or 3 minutes, but just strengthen the immune system, reduce immune load. The immune system functions like a camel's back, and it can handle a certain amount of straws. So your immune system is pretty powerful, and bacteria and viruses and various parasitic or organismic assaults from mosquitoes and whatever, ticks, they function as straws on the camel's back. Eventually, one straw is going to tip it over, or cause the camel's back to break. So what you want to do is reduce immune load. The most important load on the immune system is sugar. And it's probably tied with nutritional deficiencies and inflammatory factors. So the more inflammation you have, the more sugar you're eating, and the more nutritionally deficient you are, particularly in things like vitamin C and selenium and zinc, which are very important for the immune system, the more dehydrated you are, the more susceptible you're going to be to viral infections. We won't mention any names, but it's no accident, this is no accident, that the vast majority of people who had severe reactions to the viral infection that will remain unnamed also had metabolic syndrome and diabetes and dysglycemia. And also, they didn't do studies on this, but I can tell you this is the truth, digestive issues, histamine. This is true about any long COVID or long Lyme, chronic Lyme, always histamine and metabolic syndrome.
So the folks that died had a lack of vitamin D.
That's an intestinal vitamin. Vitamin D vitamin D is processed in the intestine and the kidneys. So blood sugar system, digestive system there also. Vitamin D should never be deficient in anybody because we get it from the sun. As long as you're in the sun, you'll have vitamin D. However, these days, everybody's afraid of the sun, and you throw in kidney problems and intestinal problems and lack of intake, because vitamin D is found in food. Vitamin D is found in fatty food, which we're all told not to eat. Milk and organ meats and such, cheese, eggs, foods that we're not supposed to eat. Many people are deficient in vitamin D. It's very difficult to supplement with vitamin D because it has to get activated. And as I say, if you have intestinal problems or kidney problems, or liver problems, you may not be activating your vitamin D. That's why the sun is the best form of vitamin D, because your skin controls the amount of vitamin D that will get into your blood. You don't have to worry about the whole activation issue. Vitamin D has to be activated. So with solar vitamin D, solar-induced vitamin D, you don't have to worry about that.
When you say take your ultimate enzymes away from food, does that mean away from your other supplements too?
No, away from calories, away from things that enzymes have to process.
Pharmacist Ben, the biggest and most important question of the evening.
Yes.
Who's going to win the Super Bowl?
Not the Jets.
You know what I meant to say to you last week?
Not the Jets.
You know what I meant to say to you last week? You said Et tu, Brute?
Everybody's giving you a hard time. All right, I'm sorry about that.
Right. Well, as usual, you're the man.
All right.
And we really appreciate you.
All right.
And we'll see you tomorrow.
Everybody. I can't wait. We'll see you tomorrow on Daily with Doc. What did you do? You went away. AJ.
Oh, wait, because you got to wave to the people. People want to
Wave
see
to the people. Bye, everybody. We'll see you tomorrow on Daily with Doc.
Welcome to Daily with Doc and Becca. This program is for educational purposes only. The statements in this program have not been evaluated by the FDA. The content is not intended to diagnose, treat, cure, or prevent any diseases, nor is it intended to take the place of your primary care physician. Testimonials are shared as individual experiences of the individual sharing their testimony. Results vary and may not be typical. We do not make any claims regarding health or income. As an empowered individual, you do have options available. We are honored to have the founding father of the science of epigenetics guiding us with the best options to obtain or maintain optimal health, Dr. Joel Wallach.